constipation is clearly associated with methane, and the amount of constipation actually correlates with the level of the methanogens that are seen on a breath test. If the cleansing waves aren't working, you're more likely to build up this bacterial overgrowth. So that's how autoimmunity can lead to small intestinal bacterial overgrowth.
We've been talking about SIBO forever, but you've got all these new pearls.
Well, one of the really interesting things is that
Hello and welcome back to the Vibrant Wellness Podcast. I'm Dr. Emmie Brown here with Melissa Gentile to bring you another episode packed with functional medicine insights and practice tips. Did you know upwards of 78% of patients with irritable bowel syndrome also have small intestinal bacterial overgrowth, also known as SIBO? What is the connection between IBS and SIBO? Could it be autoimmune? SIBO and IBS continue to be frequent concerns for many patients plagued with recurrent GI complaints. For SIBO, there are varying causes, testing methods, treatment options, and even new nomenclature that complicate diagnosis and treatment, making sustained relief challenging. Because of this inherent complexity, it is important to stay up to date on the latest developments on SIBO pathophysiology, assessment, and management for best patient outcomes. Today, we are excited and honored to welcome Dr. Ben Weitz to get us up to speed on the latest and greatest in the world of SIBO. Dr. Weitz is a chiropractor and functional medicine practitioner based in Santa Monica, California, with over 35 years of experience. He specializes in sports chiropractic care and functional gastrointestinal disorders, such as IBS and SIBO, as well as cardiometabolic risk factors, including elevated lipids, high blood sugar, and high blood pressure. In addition to his clinical practice, Dr. Weitz also hosts the podcast Rational Wellness, which focuses on functional medicine topics and features interviews with experts in the field. We're so excited to welcome Dr. Weitz to talk Need to Know SIBO updates today. Dr. Weitz, thank you so much for being here.
And thank you so much for joining me. Thank you so much for inviting me.
Yes. Hey, we're all joining together to help educate those listeners out there. So we appreciate you.
I'm so excited for this conversation on SIBO, and I want to start us off by just kind of addressing how digestive health really seems to be at the root of so many different chronic conditions today. And why do you think this connection is often overlooked in conventional medicine?
Western medicine, conventional medicine tends to be very siloed. So your cardiologist is going to look at the heart, and your endocrinologist is going to look at hormones. And so it's not too often that they're going to start looking at the entire body to consider all the connections. And so it certainly would be unusual for many patients with conditions like headaches or cognitive issues or, many fatigue, many of the other symptoms that can arise and be related to gastrointestinal symptoms. In the functional medicine world, we focus on trying to see all the connections between how the body works, and we realize that the gastrointestinal system is so crucial for the working of all the rest of the body, the microbiome. There's just an amazing amount of research is showing the connections between that and all the other various health conditions, chronic diseases like cancer and diabetes and heart disease. We have the vagal nerve that connects the brain to the gut and the gut to the brain. And so I think it's just so important to always consider the gut in almost any patient you're dealing with.
And Dr. Weitz, before we jump into the ins and outs of SIBO and what we need to know in terms of updates, can you dispel a SIBO myth or explain maybe a SIBO pearl that you wish practitioners were more familiar with and that they're not?
There's many different opinions about these things, so I'm not so sure what's a myth, but I think that it's common to think that just taking a probiotic is going to be the answer to SIBO. And I think most of the time that's not the answer, to be diplomatic.
Yes, I think that treatment plans, they really need to be holistic, as you just commented on prior, and they oftentimes are complex, but maybe it doesn't have to be that complicated. I'm hoping we can learn more about that from you. But it simply isn't just probiotics in so many of these cases. So And determining the type of SIBO will help inform the treatment. And that's part of this complexity here that we're going to learn about. So can you walk us through the different types and also get us up to speed on the current nomenclature for each type of intestinal overgrowth?
Right. So the main test to diagnose to diagnose SIBO and to diagnose the types of SIBO is the lactulose SIBO breath test. And the latest test allows us to see three different types of gases that are being produced. So essentially, with SIBO, we have an overgrowth of microbes in the small intestine and potentially other parts of the digestive tract, like the colon. And this overgrowth of bacteria, if the microbes, and I use microbes rather than bacteria because one of the forms of SIBO is caused by primitive archaea, which actually aren't bacteria. So if these microbes eat fermentable fiber, they're going to produce gas. And so there's three gases. We have hydrogen sulfide, and we have methane. And so that's how we distinguish the three types of SIBO. Recently, Mark Pimentel, who is one of the primary researchers who put this concept on the map. By the way, listen to my current podcast out right now, which is an in-depth interview with Dr. Pimentel on rational wellness. He's now calling the three forms of SIBO. We used to call them hydrogen, methane, and hydrogen sulfide SIBO. Now we have SIBO, hydrogen SIBO. We have IMO, which stands for intestinal methanogen overgrowth, which means that the methanogens, these primitive archaea, can be in the colon as well as the small intestine. And then the third type is now called ISO, or intestinal sulfur overgrowth.
Mm-hmm.
And that's what we used to call hydrogen sulfide SIBO. And also because the bacteria that produce the hydrogen sulfide gas can be in the colon as well as in the small intestine.
Right. So what we thought was localized to the small intestine, two of the three types is actually going to be all along. It could be small or large intestine. So
Right.
that's important to distinguish.
It is. However, the symptoms largely arise from the microbes in the small intestine
Mm-hmm.
because if gas is produced in the colon, it often doesn't produce as many symptoms as if it's produced in the small intestine.
So with that, and again with the IMO or the methane dominant SIBO intestinal methanogen overgrowth, if it's not primarily in the small intestine, how do
Well,
those
it's
patients
both. It's in the small intestine and the large intestine.
Right. So and the symptoms are coming from the small intestine, but
Right.
also can you see patients who are asymptomatic?
Um, sure, but we usually, if they're not going to have gas or bloating, and they're not going to have other intestinal symptoms like diarrhea or constipation or stomach pain, we're
Right.
probably not doing a SIBO breath test.
Sure, it might not be indicated at that point.
At least
It's
not in my case.
right, yeah. It's something I keep on the differential if I'm looking at a stool test and I see a pattern of dysbiosis that might suggest SIBO, but of course we want to use breath testing as that go-to assessment for SIBO. So and I'm just curious, do you notice are there patterns though to help differentiate clinically between the three different types? Do you notice any differences?
Yeah, for sure. Constipation is clearly associated with methane. So 90% of the patients who have methane are going to have constipation, and the amount of constipation actually correlates with the level of the methanogens that are seen on the breath test.
Okay, that's helpful. What about hydrogen sulfide? Is this foul smelling gas? Is what I think a lot of practitioners assume. It's gas that smells like rotten eggs, maybe?
Yes, that's often the way it's been described. Every patient's different, of course, and that tends to be associated with diarrhea. And then hydrogen can be associated with either. And of course, you can have discrepancies in all of those. But generally, we have constipation with methane, diarrhea with with hydrogen sulfide, and with hydrogen, we may have either one or we may have alternating.
Mm. And is SIBO typically kind of a standalone condition, or should it always be viewed as a symptom of a larger underlying issue?
Yes, the gut is everything's connected. There's many different things happening. When we have an overgrowth of one bacteria, that means there's going to be less of some of the commensals or the healthy bacteria. And there's always this balance between some of the, there are bad actors, what we call pathogens. There are other microbes that, if they're at a lower level, may be helpful, and in a higher level might not be helpful. So we're always looking at the balance and the interplay between all the different characters that exist in a microbiome.
And do you see a correlation with other conditions or even see patterns of symptomology outside of just digestion?
Absolutely. SIBO is been associated with various skin conditions. It's been associated with cognitive problems, with fatigue, with nausea, and it can be a minor player in cardiovascular disease and many other conditions.
And something I've learned in the last few years, Dr. Weitz, is something that I didn't get in my training, which was anything that can impact the nervous system can obviously impact the enteric nervous system in the gut. Something about Hashimoto's, TBI, Lyme disease. I think these things really go overlooked, and we tend to think about repeat antibiotic use. But the patients we're working with, typically, they're well educated and they're avoiding antibiotics like the plague. So that doesn't seem to be the case for a lot of those people. So we really have to dig deeper for some of those other conditions. You see
And
those
I
patients.
see a lot of patients who going on antibiotics was what ended up leading to SIBO.
Right.
Oh, interesting. Okay. Just
Exactly.
from
Well,
killing off all those commensals and kind of probiotic bacteria just ends up in that overgrowth?
Yes.
Wow. Hmm.
it can be a
And
blessing and a
so
curse.
you mentioned
Yeah.
thyroid. I think ideally, if you can, it would be ideal to get on every patient who comes in with SIBO type symptoms, IBS type symptoms, which is gas and bloating. That's got to be number one. Constipation or diarrhea, or alternating, urgency, stomach pain. Um, so those types of symptoms, it would be ideal to get the breath test, as we talked about, to get a comprehensive stool test. There's so many other factors we want to look at to understand what's happening in the gut. And then it would be ideal to get a nice broad serum panel that looks at all the detailed cardiovascular markers, looks at thyroid, looks at hormones, looks at nutrient status, because so many other things can play a role in gut health. You mentioned thyroid. So commonly, patients who have hypothyroid are going to have decreased motility, and
Right.
motility is a key factor in SIBO.
Right. And this is a good segue to speak to another lesser known contributing factor in some cases of SIBO, which is food poisoning. So acute
Yes.
gastroenteritis. And you already mentioned Dr. Mark Pimentel's work. Can you tell us more about Dr. Pimentel's work and his research on the link between food poisoning and SIBO?
Yes. So what happens in a percentage of cases, and this is specifically for hydrogen SIBO, which is the most common form, patients will get a bout of food poisoning. So they'll have a bacteria like Campylobacter or E. coli, and they may not even realize they have food poisoning. They just may have some mild symptoms, or they may have some stomach pain. And what happens is those bacteria secrete an endotoxin. We've all heard of lipopolysaccharides.
Yes.
Well, there's a specific endotoxin called cytolethal distending toxin. And so that endotoxin is perceived by the immune system. We create antibodies to cytolethal distending toxin, and then they cross react via the process of cross reactivity. They cross react with this structural protein in the intestines called vinculin.
Mhm.
And so when that happens, the vinculin is part of the nervous system of the gut, and that controls the motility. So then you get specifically a loss of what are called the migrating motor complex or the cleansing waves. So when you don't eat for 3 or 4 hours, the body has these waves of peristaltic activity. And that's one of the ways that the body clears out excess bacteria from the small intestine. So if the cleansing waves aren't working, you're more likely to build up this bacterial overgrowth. So that's how autoimmunity can lead to small intestinal bacterial overgrowth.
Right, and that's what we mentioned in the intro, so I'm glad you touched on that. And so I'm thinking listeners might say, well, it can be hard to prevent food poisoning if we're traveling and we want to have a good time and eat things and be adventurous and what so I'm wondering, is there an early treatment intervention that can maybe help prevent downstream SIBO after an episode of food poisoning? Has that been explored?
Yes, it has. Dr. Pimentel's preference is to have the patients take some rifaximin with them and
Ah,
just take that prophylactically. My version of that is to use a broad spectrum antimicrobial, something like biocidin,
mm,
and do it the same way.
mm,
So a patient goes to Mexico, they take some biocidin with them, and they take a modest dosage, maybe 1 capsule a day to decrease the likelihood of that happening.
so you're
So
saying prophylactically even before an episode of food poisoning to prevent that from, get to it before that even happens so we're not worried about SIBO
Yeah,
downstream.
so I'm not gonna recommend to everybody who goes on vacation to do this, but somebody who has a history of SIBO,
Sure.
who's really worried about recurrence.
Yeah.
mhm. So you're taking, recommending doing like the biocidin just as a preventative, just to take that just for the duration of the trip, just to help prevent?
Yes,
That's
especially if they're going
Yeah.
to a place where it's pretty common to hear about people having food poisoning.
mhm. Absolutely. And then what about available blood tests to help assess post-infectious IBS, which is what we're talking about here. We've talked about the SIBO that may be an increased risk after food poisoning, but we sometimes refer to that situation if we haven't really a diagnosed SIBO. We refer to it as post-infectious IBS as a cause of SIBO. So, what kind of blood tests do we have now that can help assess for that?
So we have anti-cytolethal distending toxin, antivinculin antibody test that's available through Vibrant America as well as Gemelli. So that can be ordered to look at this autoimmune part of SIBO.
When it comes to SIBO treatment, I would like to get I know we mentioned antibiotics just briefly earlier, but what are your take on using antibiotics in SIBO treatment? Or do you try to keep it natural with something like biocidin and natural antimicrobial?
So most of my patients who seek me, my care, um, if they've never had SIBO before, we're usually going to start with natural antimicrobials. Some patients have been through one or several rounds of rifaximin and failed. Occasionally, I have a patient who will say, "Can you help me? I have this rifaximin. I'm getting ready to take it, but I want to do it the right way." And I'll help them as well because there's things we can do around that, especially by looking at the comprehensive stool test and making sure that they don't have a low gut immune system. They're not lacking in pancreatic enzymes. We can look at some of the other factors. Maybe they also have a parasite or they have candida, and we might want to address some of these things concurrently. And then there's other things we can do to enhance the effectiveness of the antibiotics. But I prefer to use natural antimicrobials.
So you're kind of looking at the gut as a whole to try to treat SIBO instead of just trying to kill off all the bacteria in the small intestine with an antibiotic. So you're also looking at enzymes, stomach acid levels, I'm assuming also.
Yes, yes. So we mentioned the migrating motor complex as
Mhm.
one of the ways the body keeps excess bacteria from building up in the small intestine. So that's one of the mechanisms. Other mechanisms are digestive enzymes, hydrochloric acid, bile, which are all secreted that reduce bacterial buildup. We also have the gut immune system. And So those, as well as the integrity of the ileocecal valve and the other valves to keep the compartments of the digestive tract separate from each other. So a number of these things are really important. So if you get a stool test and you see a low secretory IgA, that's indicating that the patient has a low gut immune system. So antibiotics are going to be less effective, as well as antimicrobials, unless you can get the gut immune system working better.
I have to ask, what do you recommend for that? If you do see a low secretory IgA, what are you giving patients to help support that?
Typically, we're giving immunoglobulins.
Or just to kind of break it down further, like, are you looking at like colostrum or what type of products?
Yeah, so for SIBO, I tend to use the serum bovine immunoglobulins like the SBI Protect, because we're not wanting to cause the bacteria to grow necessarily. So, but we want to support the gut immune system. And then these products also help to bind endotoxins. So a lot of times when you treat patients with antimicrobials or antibiotics, they'll get some negative symptoms. They'll feel lousy. They'll have some increased gut pain, and that can occur because of the endotoxins that are secreted. We mentioned cytolethal distending toxin. There's other endotoxins. There's also exotoxins. And so if we can bind some of these endotoxins, the patient will have more pleasant experience going through SIBO treatment.
And what about differences in treatment plans, Dr. Weitz? If you are thinking about the hydrogen SIBO, the ISO, the versus the EMO, now that we've got all those, the different names there, all the acronyms, um, are you adding anything onto biocidin depending on the type that's been diagnosed? Kind of similar to a pharmaceutical approach where we add on an antibiotic for rifaximin in some
Yeah,
cases?
so my approach tends to be, first of all, I tend to use combination products. I tend to use 2 different combination products at a time, and then I tend to rotate it on a monthly basis so the bugs don't get used to it. So a treatment protocol with me might be 2, 3 months before we go into the rebuild and reinoculate and repair phase.
I see. So you're using biocidin, kind of weaving in that with some other digestive support, but any other
Yeah,
antimicrobial.
it might be oregano and berberine. It might
Right.
be allicin and neem. It might be, there's a number of different products. Some of the products that tend to work better, say for methane, which is particularly difficult, are high dose allicin. There's a product called Atron. Um, those are 2 that are particularly helpful for methane. I've been also experimenting on using red yeast rice because we
Okay.
know that lovastatin has been shown to reduce methane.
Interesting. That's a new one. I'm all about learning the new stuff because we've been
Well,
talking about SIBO forever, but you've got all these new pearls.
well,
It's
one of the really interesting things is that Dr. Pimentel has been using NAC with some of his
yeah.
protocols because NAC is a natural mucolytic, and some of these bacteria live in the mucus layer in the small intestine,
Hmm.
which is probably because some of these bugs are anaerobes and there tends to be oxygen in the small intestine. So for them to survive, they tend to live in the mucus layer, and the methanogens tend to live in the mucus layer too. So adding some NAC can help break down the mucus layer. Now, Dr. Pimentel is working on a special slow release form of NAC, but I've just been adding oral NAC and seeing some good results.
Very interesting, especially, and it's a bit of a paradox if I'm understanding this correctly, when we tend to think about Akkermansia building that protective mucus layer, but in the setting of SIBO, maybe we want to work on breaking some of it up a little bit, right? To get to those organisms.
Yes, and I think there's this fine dance.
Hmm.
There's probably some interrelationship with fungus as well in the gut, and I
Oh
think
gosh.
that's not been fully explored. Dr. Pimentel has shown that there is CFO. He only sees it in a small number of cases, but I think there's some interplay between the fungus and the bacteria and uh, fungus tend to reduce the oxygen and maybe enhance the growth of some of the anaerobes. And some of Dr. Pimentel's latest research is he's actually seeing some fungal elements in there. And so I think there's a dance of all these different microbes, and we don't want to think of these microbes necessarily as bad or good. They're just overgrown. So, for example, methane, we tend to think, oh, that's a really bad one. We got to get rid of that. But it turns out that patients who have IBD have little or no methane, and methane may be protective against inflammatory bowel disease
Mm.
at a lower level. At a
Yeah.
higher level, it's a problematic. So, like with so many things, the issue is the dosage.
It's a delicate balance. Like you said,
Right,
it's a dance. It's a dance of all these microbes, having
right,
a party in there.
right. It's like talking about H. pylori, and some people say automatically you see H. pylori, you got to get rid of it. And
Mm.
then,
Yeah.
if you've read Martin Blazer's book about missing microbes, we know that H. pylori has a lot of benefits as well. And so a lot of it has to do with the dosage and how the body handles it, whether or not you have virulence factors. So
And I do want to get into the nutrition piece just slightly, but I know we're getting close on time here. But I do want to ask before we move on from supplementation is what kind of probiotics, if any, are safe during a SIBO treatment protocol? Just to kind of help protect the gut microbiome from wiping out everything for using a lot of antimicrobials.
right. And I think that's one of the important things about getting a stool test right off, because some patients will have a pretty decent amount of commensals, and yet they have this overgrowth, where some patients, their commensals are completely wiped out. So you have to be a lot more careful. There are a few specific strains, like if you go to Jason Harelick's probiotic advisor, he has all the latest research on this that have been shown to reduce certain forms of SIBO. But I tend to use spore-based probiotics if I'm going to add them in the initial phase, because our understanding is they don't open up until they get into the large intestine. So they're not going to add to the bacteria in the small intestine. So that's my recommendation, is to use a spore-based probiotic.
Gotcha. What about Saccharomyces boulardii? I know that's a really common one to use in these kind of protocols. Is that one safe for
Uncontroversial.
SIBO, you think, or not really?
I think it is. It
Okay.
depends on the patient. As soon as I say that, patient will walk in my office, does horrible with Saccharomyces boulardii. But
Yeah.
that's part of the individualized part of functional medicine is, we've got to individualize care to each patient.
Mm. Gotcha. So kind of just paying attention to symptoms there. Uh,
Certainly lactobacillus is not a good choice.
okay, well, we'll X that one.
Wait, can you
Kind of,
explain why quickly?
yeah.
Please.
Well, I'm actually speaking from research. Dr. Pimentel has specific research showing that lactobacillus makes SIBO worse.
Is there a suggested mechanism, or have they just observed that at this point?
Yeah, I think they've observed it. I think some of these commensals help the bacteria that cause SIBO, which,
Ah,
you know,
they're in cahoots.
they're in cahoots. Exactly.
It is so complicated, as you said. So it's very delicate.
Yeah.
And when it comes to like nutritional recommendations, I know it can be pretty challenging to try and recommend a SIBO specific diet because again, we do want to feed commensals, but we also don't want to feed the SIBO. So how do you go about diet recommendations and changes?
So first of all, it depends on the patient, which I've only said about 1,000 times. But
Right.
some patients will come into your
Okay.
office and they've been on this journey for a while, and they're only eating 4 foods. So
Yeah.
I'm certainly not going to restrict their diet at that point. So if patients have been on a restrictive diet for a long time, I'm not going to restrict it anymore. And you got to know who you're dealing with. If it's somebody who's tending towards anorexia, I'm going to be super careful about not restricting the diet or putting limitations. But for somebody who's new to the journey and has been eating lots of gluten and dairy, I think it makes sense to do a course of a low FODMAP diet. Now, keep in mind that when we talk about low FODMAP, there's no food that doesn't have any fermentable fiber, whereas these foods are the only ones that do. We're just trying to decrease our intake of foods that have a lot of fermentable fiber. So even if we follow a low fermentable, low FODMAP diet, they're still going to be getting some fermentable fiber. We put these foods in categories, low FODMAP, high FODMAP, but a lot of the low FODMAP foods have some fermentable fiber. So I think the key is we just have to reduce the amount of fermentable fiber.
And do you like to implement like any kind of fasting protocols? I know you mentioned earlier with the migrating motor complex and making sure we at least have those 3 to 4 hours between snacking our meals. But do you implement a certain range of it, like an overnight fast, just to give the digestive system a break or to starve anything out?
Yeah, 100%. A 12-hour fast overnight is really ideal. And for a lot of patients where we're suspecting their motility is decreased, we'll have them use some natural prokinetics at night while doing a 12-hour fast to facilitate that MMC.
What are some of those prokinetics that you like?
They're combination products that contain ginger and artichoke, sometimes 5-HTP.
I love it. Well, Dr. Weitz, this has been such an insightful episode on SIBO. I feel like I was taking notes here while we were recording. I'm probably going to have to go back and re-listen to this one and just kind of perfect my notes here because we had so many recommendations on diet and supplementation and how to diagnose, what to diagnose, and even some new research from some other providers as well. So thank you so much for taking the time today to educate us. I know this episode's going to be super insightful to our practitioners who are specializing in gut health. And if anyone wants to learn more about your practice, your work, maybe there's some patients listening in that are like, hey, I think I have SIBO. I want to come work with you. Where can we find you online?
You can go to my website, which is drweitz.com. You can check out the Rational Wellness Podcast on Apple Podcasts, Spotify, YouTube. And you can call my office in Santa Monica at 310-395-3111.
Awesome. We'll link this down below for you guys that are listening in case you want to get in contact. And again, thank you so much for taking the time to share all of your expertise today. And until next week, wishing us all vibrant health and wellness.
I wish you all a vibrant health as well.
Thank you, Dr. Weitz.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness Podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.